Hey, this is Eric Durek, and welcome to this episode of Med Health Fit, the TV show that integrates wellness and healthcare. And tonight I have a very special guest, Mr. Larry Traeger, who is the co-founder and I'm going to say CEO of Corporate Touch Santa Barbara, one of the longest massage schools in businesses in town. And Larry and I met, oh my gosh, 20 some years ago. When we worked together in a rehab agency. But first and foremost, I want to learn a little bit more about what Corporate Touch Santa Barbara is all about. So tell me a little about how you got started.
Sure.
And a little bit how the business has developed.
Okay, a quick story. Okay, I'm a brand new massage therapist in 1979. Went back to New Jersey, my home state. And I'm used to doing hour massages, hour and a half massages. Well, so one night, I'm in a restaurant, a diner. In New Jersey, we have diners. In a diner with a friend, and it's like midnight. And we noticed the waitress is looking really haggard. And she came over to take our order. The restaurant was empty. And we said, would you like to sit down and take our order? And she said, yes. And so, this, of course, is very unusual that she would accept the invitation. And I asked her, what's wrong? What's happening? And she goes, I'm doing a double shift. Somebody called in sick.
Oh, my goodness.
So had a lot of sympathy for her and said to her, I'm a massage therapist. And could I just work on your shoulders for a few minutes?
And she said, no, keep your hands off me.
Wasn't such an issue. I think, I'm very gentle. I asked very gently. And so she said, okay. So I worked on her for 6 or 7 minutes. And then she just went, she just went about her business. And my friend and I hung out for another hour or two in the restaurant. We watched her for that hour or two racing around the restaurant.
Order to order, table
Order
to
to order.
table.
Yeah, the restaurant filled with people. And she had a smile on her face. She had all this energy. And I'm sitting there going, what happened? Because as a massage therapist, I'm used to doing hour massages, hour and a half massages. What happened in about 7 minutes? And so what I realized happened was that when you relieve tension from where people hold it the most, they get a bounce, a benefit that is far beyond the time spent.
Now, you didn't invent chair massage. That's been around for 50 years, whatever, 100 years maybe.
Right.
But you sort of brought it into this area,
yes.
I think at least.
Yes.
And so you took that concept, hey, I can have an impact in 7 to 10 minutes.
Yes. And actually, the first massage I developed was only 7 minutes long. That was way back in the 1980s. There was a few of us pioneers in California. There was a fellow up in Northern California who actually, David Palmer, popularized it around the whole country. He went and taught. I stayed in this part of the state and had a chair massage company then. It was a very hard sell then. And so after 10 years, let it go. But then, 18 years ago, bought a small chair massage company here in Santa Barbara, and that exploded. And that's Corporate Touch.
What was the impetus for having to let go one company that wasn't maybe doing financially, and then buying into another company, and all of a sudden you've got clients and businesses and all this other stuff?
Well, I was a little seduced into it because what happened was I had done all that hard work in the 80s, against company managers that thought, no, it's not good to relax at all at work. And then 20 years go by and company owners and managers know that high stress is not a good thing for people.
Right.
It makes them less productive. They can get ill. So chair massage had an opening. It was starting to happen. And so I bought that chair massage company with my wife in the year 2000. And a couple of years later, we landed one of the largest companies in this area. Actually, it was all the hospitals. And then a couple of years later, Raytheon became our client. And then it just kept expanding from there. So now we're doing over 10,000 chair massages a year, and we have 10 massage therapists.
There you go. So that's a company.
Yeah, but the exciting part is really where it started, though. It's that people can get their stress relief so quickly, and for many people, because it's safe and it's done clothed, it's the first professional massage a person may have had.
Right.
We introduce people to it, and then all the different health benefits that massage therapists can share because they know a lot.
Right.
So people can really change their health. So,
and chair massage is interesting because I've been to a couple of conferences, and more of these conferences will have a company that has an expo booth.
Yes.
And I was in San Diego recently for a health and fitness conference, and I don't know which company it was. It was a local company in San Diego, and they bought not a 10 by 10 booth. They bought like a 30 by 30 booth. So it was in essence about 3 or 6 actual booths. So they spent thousands of dollars to give these massages. And I remember that myself and a colleague of mine were there at 3 minutes to 5, and they closed at 5 o'clock. And I said to them, I said, well, what if I tip you in advance? And both of the massage therapists, so we got these, 8-minute massages, and it was really, it was fantastic, and they had been working really hard that day, because you know how it is when you work a fair.
Well, many hours doing chair massage.
Many hours. So all right, so where did you, now, it was interesting that before the show we were talking about you're from New Jersey, and I lived in New Jersey for a little bit, and so did you get your massage license there and then bring it to California, bring it to Santa Barbara?
My original training was actually in Washington State back in 1978, 79, and that was a little known field called polarity therapy. It is a kind of body work, really wonderful. So, however, when I moved to Santa Barbara in 1981, I needed a Santa Barbara license in order to practice here. So I went to one of the old schools back then, Santa Barbara School of Massage,
which is still in existence.
No, they're not around any longer.
Okay.
Yeah, no, they're not around any longer. They were, and back then it was so simple. It was you learned Swedish and shiatsu. That's all you learned. Okay. And so, but I already brought many skills to it from the training I'd had before, and started to integrate things, and that's really what my career has been about, is integrating different therapies to make the most impact.
Well, okay, so the two schools we have now is Santa Barbara
Body Therapy Institute. I'm not sure if there's another school now, honestly.
No, I thought there were still two of them. I thought there was one on Milpas and then one on Mission Street.
That one closed.
Oh, okay.
We have one major school left.
Okay,
well, the thing is that standards keep going up and up. It gets harder and harder to have a massage school that's accredited by the state, because state accreditation is essential.
Yes, and there's a lot of industries, like the health and fitness industry right now is really battling with accreditation, because everyone wants to be like medicine, and I look at it from this third party and I say, nah, you shouldn't be like medicine at all. Anyway, so you and I met back in the early 90s at Mission Rehab, and I was working with renal disease patients, and you were working with sort of a myriad of patients, and this is going to sort of lend us to the second half of our interview on kind of your clinical work. But what types of people were you working with at Mission? Because I remember there were 2 or 3 of you working. Really, it was a great working.
Now it was orthopedic, so we were working primarily with a lot of work comp injuries, and we were doing post-op, people coming in to get physical therapy after a surgery. What was really unique about that particular facility was the director, Joe Barnett, totally believed in massage therapy before people had their physical therapy. So they would get those muscles loosened up, and in my case, they'd get real therapy to power up their muscles before they actually went to do their physical therapy exercises, which made a big difference in their exercises being more efficient, less pain in exercise.
Well, I worked with Joe at Sansom Clinic for a couple years before he made, that's how I knew that he had his own place, because he invited me out to see, and I was interested in starting this program, but I thought it was unique that you guys were really working pretty diligently with these patients. Now, I didn't know exactly who they all were, but Joe's philosophy was that you could work with them, and it was all part of the physical therapy as a whole. It's not like you guys just do your thing and then I'll come in and do. It was all, their treatment was sort of this holistic thing.
Yes, it was integrated to give the best result that we believe possible for these patients. And so we had a physical therapy assistant and a lot of massage therapists. And so all of the massage therapists were trained in the exercises, and of course the director would direct us in that. But the therapy part ahead of time, we had a particular, we had some freedom in the kind of massage therapy, all approved by the director, but we had a freedom in what we actually applied for each patient, which allowed me to do a lot of really unique therapy. Actually, Joe Barnett really liked what I did, and he had me train the staff in what I was doing.
Well, I remember that you guys were doing some really good work. We actually spoke about that when we had our last coffee session a couple weeks ago. But while you were there, you was sort of this, you made a transition in your career whereby you were just doing, I would say, an element of physical therapy to actually working with a subclinical population group that has sort of become part of a hallmark of your business model right now, and it was working with stroke patients. So tell us a little bit about how the humble beginnings and then kind of where you are today.
Sure. Back then, I worked with Joe Barnett at Sansom as well, and then transitioned over to this Mission Physical Rehabilitation. So between those two organizations, I worked on many hundreds of patients. Mm-hmm. And I was using different techniques that I'd learned and others that I had developed. And I'll describe them in a little bit. But I'd had practiced these techniques which help people recover faster and get stronger quickly with all these patients, hundreds of them. And then one day at the clinic, a stroke survivor walked in. He wasn't the patient. His name was Jerry, really sweet man. His wife was the patient. He just walked in with her. And I saw him, and it occurred to me, look, if these movement techniques and other muscle strengthening techniques I use work so well for, quote, regular folks, folks that haven't had a stroke but have had injuries, well, isn't a stroke a brain injury that affects the body? Maybe there's a parallel here, and I could try it. Well, Joe was very generous, and he said, go ahead, give him a session. So I gave Jerry his first session, and this man had had a stroke 14 years before. He'd had a drop foot, which was surgically stitched up, basically, so he could walk at all. Mm-hmm. He was bent way over. He had to hoist his leg forward, and the most he could walk was about 2 blocks, or he'd just be in so much pain from doing it. So that was where we started.
How long was that session, the first one?
These were, how much time did I get with him? I probably had 30 to 45 minutes with him each time.
Okay.
Okay. And Joe actually let me work with him for 2 weeks, 6 times. 6 times in 2 weeks. And so with Jerry, I worked, well, I'll get into describing the techniques, we'll have to get into that. But we worked together for those 6 weeks, 6 sessions. And after that, Jerry was able to walk 2 miles without pain. Mm-hmm. And he was standing upright.
First time in 14 years. Right?
Yes, yes, since his stroke. So this proves some things. One is that people can, thanks to the neuroplasticity, the ability of the brain to rewire itself, people can improve many years after a stroke. They can have changes in their body.
Well, neuroplasticity, as I'm sort of writing a note here, is a big deal because of the new, well, a few years ago, and they had the neuroplasticity brain exercises for seniors. And this company got so good, it did such good work so fast that it went from a small, startup internet company to doing national television commercials. It was a multi-million-dollar company that was getting contracts with hospital systems and senior centers and whatever. And because they use the concept of neuroplasticity, which what you are describing is that the brain or the central nervous system, a combination of them, the neuromuscular system, can be re-educated and redirected. As a matter of fact, one of the things I learned when I was working with you and Joe is the whole concept of neuromuscular re-education, which is a billing code for the healthcare system. So you have the ability to do that. Therapists have the ability to sort of teach the body how to do something differently. So with Jerry, he was walking, he was pain-free. How did subsequent programs go with him? I mean, you worked with him for a little bit after that too, didn't you?
Only a little, really, and then I lost track of him. Some months later, I left the clinic and went into private practice totally. I had now spent 14 years working for chiropractors and physical therapists. So after 14 years, I was really ready to be out on my own. So just seek my own clients. Right. And that began my private practice. But I wanted to talk about what I did with Jerry. I mean, it wasn't a mystery. It was really applying the same techniques, as I said, that I used with orthopedic clients, with people who had been in work comp injuries. So there's really 3 parts to it. The first part that I always do, I call it instant muscle strengthening, and I'll demonstrate it for you. The second part is nervous system re-education. That's the neuroplasticity part.
Okay.
And the third is muscle tone fine-tuning.
Okay.
So we can do a little demonstration of the instant muscle strengthening.
Okay.
Okay, so to do that, a lot of kinesiology in my work. So to do that, first let's take your right arm, just hold it straight out. I'm going to put some pressure on it. I'm looking to see if it'll lock in place, meaning it has a full contraction. So I'm going to lean on it now. Hold, 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 hold. That is a nice full contraction. All I can get is the tiniest waver out of it.
Okay.
Okay, so now let's do your left arms, do the same thing. Ready? Okay, hold. hold, hold. See how shaky that is? Does it feel different to you than
A
the
little
right arm?
bit, yeah.
Yeah.
There's
Well,
a little, like a little
yeah.
more fatigue or so.
Yeah,
on
well, the
side.
thing is I'm doing it lightly because I don't want to hurt.
want to
I don't
bang
want
on
it to hurt. Well, exactly. No, if I did the same amount of pressure on the right, it would collapse right away. But I want you to get a sense of what it felt like.
Yes.
Okay, so then what I'm going to do is I'm going to reach over to your neck. Okay, I'm going to touch this vertebra. I'm just going to be very gentle with it. I'd like you to take a full breath and hold it for a few seconds. I'm just rocking. Let that one out. Take another breath and hold it for a few seconds. Very good.
Interesting.
And one more. Ooh, you felt something. Take one more breath. Yeah. Okay, good. You may need to do more, but let me check again. Oh, okay, straight arm, please. Hold it up. Hold hard. I'm pressing very, very hard, Eric. Very hard.
Okay.
Can you feel the difference?
Yes,
Yeah.
absolutely.
Okay, great. So that's instant
Almost
muscle.
100% difference, 60, 80%,
Yes,
where
huge.
there was that fatigue, and all of a sudden it's almost like you weren't
Yes.
pressing at all.
So imagine a stroke survivor who has weak muscles like this, and I do that kind of strengthening, and it's just about instantaneous. So imagine the difference that could make in walking or using
Right.
using their arms. So that's all the first step, is that the muscles have to have a good contraction. That's all I did. I improved the contraction. This doesn't have to do with muscle tone, because you have nice tone. It doesn't have to do with the actual tone of the muscle. And very often, actually, stroke survivors need to retone after I work with them because
Right.
of the wasting away that
Right,
happens.
they're-
So that's first. Next is the nervous system re-education, which you really can't demonstrate here, but just to use Jerry's example. So I would have Jerry take a step forward with just the left foot. And then I would muscle test him. And I would, through the muscle test, I could see that it was stressful for his body to just even take that first step. And then I'd use a very simple technique, holding a couple points on his head, and that would create this reset of that circuit. It works in about 30 seconds. And honestly, you know, for the audience, it's very hard to believe until you actually see it and experience it. So then I would have Jerry step back, and then I'd do the right foot forward. And I would test the muscle and show that his body had a stress response to that. And then I would just correct each of these movements. There's forward walking, there's backward walking, there's sideways walking,
Side to
there's
side.
pivoting, just all the different ways that we move and that we walk. And then after that, Jerry would walk. And what would happen is the walk was vastly smoother than it was when we started. So between strengthening the muscles so he could stand up straighter and then doing each of the tiny movements involved in walking, I was able to smooth his gait. And this has worked, like I said, with hundreds of patients before him, but he was the first stroke survivor. But then there's one last piece, because when people have been using their body awkwardly, other muscles tighten up. It's a way of adapting. If let's say someone's hurt their low back, for example, the legs tend to tighten up to support them. It's like, okay, your brain thinks you want to walk, well, your back is in terrible shape. I'm going to tighten up your glutes and the back of your legs and tighten up all that so that you can walk and stand. So then, once this work has been done so far, then the tight muscles need to be loosened. And that's done. There's some detective work in that, a lot of muscle testing on my part. I find the tight muscles, and I use a technique that relaxes what are called the spindle cells on the beginning and the end of each muscle, and I stretch them. And that causes an immediate relaxation of that muscle. And then that muscle stops interfering with the smooth movement. So those are the three parts.
Interesting. So,
yeah.
And how many stroke patients have you worked with since Jerry? I mean, this is 20 years ago. You've worked with a couple dozen or so, haven't you?
Unfortunately, the stroke survivors I work with is only in the dozens. You know, the orthopedic patients, in the hundreds, many hundreds. So what I wanted, you know, through all these years is to really find more and more stroke survivors. And that's why I'm here today. That's why I have a group on. I have also tried, you know, through normal channels like going to the local rehab hospital and such, but unfortunately they don't feel they can work with me, and it probably has to do with my licensure. You know, I am state licensed, but as a massage therapist, rather than as a physical therapist. So
yeah, but I think that without getting into this,
and I love those people over there, by the way.
Oh no, the Rehab Institute here in Santa Barbara does amazing work. Because I've known a couple folks who have had head trauma injuries that have gone there, and one guy was in really bad shape and spent quite a bit of time there, and then had almost full recovery. But the issue here is that, you know, what you do, which is so good, and I'm seeing some issues in healthcare, which is one of my next questions, and I'll actually just jump into that. Is that is that, you know, you've done this great work with stroke patients in the clinical setting, and there may be some global benefit in having stroke patients or spinal cord patients or somebody work with massage at a particular level, independent of what they do in the acute care setting, whether it's PT, OT, advanced nursing, whatever it is, that when they get into this transitionary phase, that there's really nothing there. And my knowledge of healthcare programs in the health club setting, like here in Santa Barbara, you know, I've talked about on this show a couple times, where back in I was working at the Santa Barbara Athletic Club when I was at Mission. I'd go from the club to the rehab center, and we actually had cancer patients come through there, and they were referred by the Cancer Center of Santa Barbara, and 25 years later, they're still getting referrals all the time. I mean, it is one of the most successful programs of its kind in the United States, and when I left the athletic club, Paula Lilly was the director then, and she is today, and she has probably established an expertise with herself working with thousands of cancer survivors in the health club setting. So what she's doing is a tremendous long-term program, and I would say kind of the same thing with massage. And this is one of the issues that I'm looking at in the healthcare system, because it's so expensive. Healthcare's rate of inflation is almost twice that of any other business in the United States. We're looking at almost purely a pharmaceutically based treatment modality. And when I'm looking at, and I try to read as much of the holistic health literature, et cetera, in that holistic practitioners, especially people who are working in holistic medicine, they're looking at homeopathy, they're looking at different types of vitamin therapy, etc., are really having a tough time these days, because, you know, the FDA is now trying to go after homeopathy again. They're trying to go after other types of like certain vitamin things again. And I'm reading on most of the mainstream, you know, websites about, oh, vitamins aren't any good for you. And then I read about, like today I was reading on Mercola.com about how vitamin B12 deficiency has become so rampant in the United States that people are actually coming down with these diseases. The doctors they're not sure how, they think it's a neurodegenerative type disease, which it is, but they don't understand that it's a vitamin B12 deficiency. It's you know, these simple fix type things. And massage in and of itself isn't a, quote, simple. I mean, there's a lot of neurophysiology and anatomy and stuff that you guys have to know. But the essence of it is that once you get good at what you do, you can kind of go in there and I know how to fix this, you know what I mean? Just like what you said with me. I mean, there are certain things that you know how to do.
And you know, you were talking about the collaboration or lack of. You know, my vision is really to work side by side with physical therapists, because it's so complementary. What I love is when someone is seeing a physical therapist or an occupational therapist and they bring me their exercises. Okay, they show me, this is what my physical therapist wants me to do in order for me to be able to get better at, whether it's a particular kind of movement or, anything, functional. And I say, okay, show me your exercise. And so what I'll do is just what I did at Mission Rehab, is I will fine-tune their body to do that exercise using these techniques.
And you're actually having them be better able to perform that exercise because you've retrained the neurological system to make it more efficient.
Because what usually is the procedure with the PTs and OTs is it's by repetition. That you hope the neuroplasticity will happen if you repeat it enough. But as long as there's movement in the area, I can do it like in an hour or two. I can really have it happen much more quickly. That's why I want to work together. I actually did want to spend a minute or two talking about the kind of outcomes and who with, because over these years, through the stroke survivors, I've seen, I can divide them up into about 3 groups. Now, a neurologist would probably have a lot more groups, but from what I've experienced, 3 groups. One is, now this is all post-acute. This is all their acute therapies done. They've gone gotten some post-acute therapy, and they're permanent stationary. This is where they are pretty much, is that the folks who are still left with significant paralysis and stiff muscles. That's one group. The second group I've seen is where a person can move, but they have slow labored movements. It's a really a lot of effort for them to move. Kind of like, you know, they're in molasses. And it's effortful. Okay. Okay. Then the second group, the third group, is where the stroke survivor has relatively free movement, but poor coordination. You know, like they may have difficulty eating or washing or walking. That they tire easily walking. They can move. Yeah. They can move, but they tire easily, and that's because the brain is still doing it manually. You know, the manual system, like to be able to do something when you're injured, is our backup. Thank goodness we have it. But the moving automatically, the brain does it silently. That's the real system we're supposed to use. So the backup system is very tiring to use. So that's what stroke survivors are using almost all the time. So what I found through the work is, it's the third group that I help the most. The ones who have some freedom of movement but need the more coordination. I found that I am not a wizard and I cannot change paralysis.
Okay, so not Harry Potter.
Yeah, yeah, and also those folks who have the slow labor movements, I can make them stronger. The first part, I can make them stronger, but I don't have any magic to unfold from the inside, whatever it is. It's like a governor. It's like a governor in your system. I have not learned yet, but I'm working on it, about how to free that governor so they can just move more quickly.
Well, I would think that if you had enough time and enough resources, like a government grant or a collaboration with a university or something, like somebody at UCLA says, Larry, come on down for a month.
I know. Or the research I want to do with a rehab hospital, for example, to like how to keep expanding it to different groups to help.
Well, I do think that, and we have about a minute and a half to go, I really do think that there is a shift going on in healthcare. And I think that it really is the people in your situation where you've been in the trenches. You've been in the trenches a long time. It's not like, oh, I just got out of massage school last year.
It's almost 40 years.
Almost 40 years that you've been doing. So when you speak about something, you have this breadth of knowledge and experience that people today, they don't understand how difficult it was in the 70s and 80s to sort of get. And I went through the same thing in the 80s as well, when I was working with my diabetes patients, et cetera, and that people would say to me, well, you're not such and such. And I said, yeah, but anyway. So that being said, as we're moving forward. So in the last couple seconds that we have, let us know how we can get a hold of you through your website.
Well, website, corporatetouchsb.com.
corporatetouchsb
as in Santa Barbara.com.
And
I have a group ongoing for my stroke work.
You have a Facebook page, or you pretty much your website?
Pretty much the website, yeah.
Okay, and what's your phone number?
Yeah, 805-966-7570.
Great, and what a great conversation today. So on behalf of Corporate Touch Santa Barbara and Larry Traeger, one of Santa Barbara's oldest and most established corporate fitness businesses, this is Eric Durak for MedHealthFit. Thanks for tuning in, and we will see you next time.